Welcome to the DSO Hygienist podcast. I'm your host, Christine Deal. I'd like to thank our sponsor, Twice as Nice Uniforms. Dressing for success, infection control, and comfort is crucial for the DSO team. Not only do they need to look great and feel great, but they need to be dressed for safety. Your patients will notice when your team is dressed appropriately, and your staff will perform better. Who better to help your team with these decisions than Twice as Nice Uniforms? Owned by a seasoned dental hygienist, branding expert, fit specialist, and fashion model, Twice as Nice Uniforms are designed to follow infection control and OSHA regulations, alleviate the thermostat wars in your office with temperature regulating technology, and provide long-lasting professional-looking scrubs, lab coats, and accessories. Custom uniform programs will take the burden of painstaking ordering, exchanges, and returns off your shoulders. They are proudly made in the USA. And Twice as Nice is giving our listeners a discount code TDH2024 to take advantage of this special offer. On this episode, our guest is Stephanie Reynolds. She's a dental hygienist and has a bachelor's of science in dental hygiene. She has been in the dental space since the age of 17, starting off as a hygiene assistant and working her way up into becoming a dental hygienist. Shortly after graduating with her associate's degree and licensure in dental hygiene, she went on to pursue her bachelor's degree in dental hygiene at the University of Michigan. In addition to general practice, she primarily works with the pediatric and special needs community. As a hygiene coach and clinician in the DSO space, she has the privilege of having one-on-one interactions and hands-on experience with patients, as well as working and collaborating with other providers. As a hygiene coach, she encourages collaborative growth among her team that promotes patient care and overall support to the hygiene community. Stephanie has a passion for community dentistry and even had the opportunity to participate in a dental mission trip to Honduras in 2018. In addition to the clinical practice, she has a vested interest in dental hygiene advocacy, public health, and interprofessional collaboration. In her spare time, she enjoys crafting, yoga, and traveling. Welcome, Stephanie. Thank you for joining us. I have so many questions for you. Let's just jump in. I'm going to start with your role as the pediatric hygienist. So can you describe for me a typical day in your life?
Yeah, well, first off, thank you so much, Christine, for having me. It is truly an honor and a pleasure, and I'm so excited to speak about things that are hygiene, especially related to pediatrics. So I would almost say that a typical day for me is, it's like any other, hygiene day, but I definitely want to make sure that, going through and auditing schedules, making sure that I'm looking at, especially when I'm dealing with kids for the day, looking at previous notes, especially if I have kids that are maybe more sensory, things that are specific to them. I'm also looking at opportunities for, have we had our sealants yet? Are we due for panoramic x-rays? Are we due for our bite wing x-rays? Is this their first visit? And then I have a really, really good relationship. I'm so fortunate to have a good relationship with my doctor and team, and I always co-collaborate with him at the beginning of the day of, hey, what do you think? Or is this something that you're looking for the day? Or, do you have anything that you were previously watching? Or, can we do same day sealants? So always looking for opportunities, especially for parents that have kids that are on busy schedules, being able to make the most of the day.
Yeah, sure. I get it. So what are some common oral health challenges that you observe in children?
Yeah, so that's a big one. I mean, as we know, cavities are, of course, the number one, but the number one thing that I cannot express enough is having kids come in before their kindergarten, age frame. A lot, for Illinois, we recommend those school forms at kindergarten age, but I will say when kids come in, especially at that kindergarten age group, a lot of times they've already had a lot of their big doctor visits where they typically then, once they come to see us, then they affiliate us with something maybe a little bit more unfavorable. They have that white coat syndrome. So not only for, two reasons here. One, to kind of create that exposure of parent and child, of getting them used to us, so then it's very routine by the time they do start to get some more of those frequent doctor visits. But number two is from a prevention standpoint. So a lot of times we have kids that by the time they come in at age 5, they are already presenting with interproximal caries. They come in with baby bottle caries. So not only from a hygiene perspective, that's super important, but an education perspective. So with pediatrics, there's a big talking component of not only just diet, home care, patient education, even from sports medicine or wearing your night guards. But there's so many components, especially diet with kids, just the frequency that they eat, and sports drinks, acidic beverage, sugary beverages.
Sure.
Baby bottle caries. It's, to us, it's like, how could this happen? But it's, for parents, you don't know what you don't know. So as our jobs as prevention specialists, to have those conversations to hopefully prevent them before they get to that point. But it's the number one thing, especially bringing them in as soon as they start getting teeth. A lot of parents with kids that are school age, when they have their new little babies on board, they start bringing them in much sooner, so then we kind of get them into that routine. And it makes the hugest of difference.
Yeah, I totally agree with you. You cannot wait till 5, because that is just terrifying, because I look just like the lady who just gave them a bunch of shots.
Yes. And they're like, I don't like you. I already know it. And it's like, okay, we got to work backwards now. And it's we can prevent that. But
and I think today more and more parents know to bring their kids in earlier, and we are avoiding a lot of that, because I have so many parents that say, oh my gosh, my child loves coming to the dentist.
And then it builds a healthy foundation into adulthood, where, on the flip side, I've had unfortunately, a lot of adult patients where they're like, I had such a poor experience as a child. I haven't been to the dentist in 30 years because of it. And they're traumatized. And dental anxiety is real, and it breaks my heart. So having a big component in pediatrics to help hopefully prevent that, because not only are we saving our kids, we're saving our adult patients too. And, we want them to bring their kids and bring their nephews and nieces and brothers, and, so we want to make it, even though it's serious business, we want to make it a fun experience where it's educational too.
Yeah. So tell me a little bit about how you build rapport with your young patients to create that positive and comfortable environment.
One of my favorite questions. Honestly, I think that's one of my absolute favorite things about being a pediatric hygienist. And kids just bring me so much life. They are truly the funniest little human beings, because every kid is different. And I think getting to know the child first before you dive into the serious stuff, you make them feel like truly like they're the star of the show. And, when you have a kid and a parent involved, making sure that the kid's involved and incorporated, and not just talking at the parent, but really involving them in every single aspect of the conversation. And you'd be surprised to see how much kids absorb. I'm sure any parent can say, oh yeah, my kid absorbs every single thing that I do or say, but they really want to know. And I can't tell you how many times patients are, like the little ones too, are, hey, what's that on my x-ray? Or what color is that? Or what does that mean? Or what is that? And it's so fun to get them incorporated. For my kids that are a little bit more reserved, a little bit more quiet, where they're still trying to build that, like, I don't know if I like you yet. I don't know if I can trust you yet. It's starting off with a simple, you have a dinosaur shirt on? Hey, buddy, do you like dinosaurs? How many teeth do you think a dinosaur has? I bet you have at least 300 teeth. And then their eyes widen and they're like, oh, there's no way. Let's count them together. And then you start to build and instill that trust factor. And it's just such a fun process. And then when you come back and they're like, oh my gosh, Miss Stephanie, I got a cat. I got to tell you about it. So it's just like a fun little meetup. And it's just like it's like a coffee chat with all my kids. And it's so rewarding to see them every time.
Yeah, I can tell you are just great at this. So when after collaborating with the child and how you do that, so how do you confront the parents, and how do you collaborate with them to get a personalized oral care plan for their child?
Yeah, sometimes, it's a tough love, and sometimes there's tough conversations that need to be made. Especially my conversations with not only the kids, but the parents, I never want to shame a parent or make them feel like they failed their children, and truly for parents, it's you don't know what you don't know. And that's our job as prevention specialists, to let them know, Mom, you're doing a great job, but here's some things just so we can prevent this from going forward. Or, hey, here's how, we can make this work. There's some things, of course, with genetic factors, that are out of our control, but hey, here's how we can get you where we need to be. I know there's different types of learners out there. I'm a very visual learner. That's the hygienist in me. I utilize intraoral cameras, x-rays, and sometimes even just simple analogies with parents of, comparing a tooth to a sponge, or, when we're getting those 6-year-old or 12-year-old molars, we've got those operculums over, and I always compare it to like a sleeping bag where things want to get stuck in there, and we got to keep that area clean. So, I think we get into those autopilot ways of that dental terminology of very serious business, and sometimes you just got to bring it down a couple levels and make it understandable. But I utilize especially a lot of intraoral photos and x-rays of, hey, here's what I'm seeing, here's what doctor's seeing, this is an area that we can't watch anymore, this is something we have to treat, and this is why this is happening. These are cavities that are in between the teeth. This is what's causing them. This is how we can prevent them. If these are cavities that are on top of the teeth, on the biting surface, maybe it's more diet related, or maybe our bite's off. Do we need to talk about ortho? So there's so many roads that this can go down, but I think the moral of the story is having a conversation with the parent, not talking at them, talking with them. Let's create a plan, and not making them, completely feel like I failed, because when you feel like you failed or you did something wrong, it's hard to bring them back up. So I definitely I create a very, I don't want to call it light, but a positive environment where it's like, okay, here's what we're seeing now, but let's prevent this, or let's get you where you need to be. It's going to be okay, So I think that's key.
And I think parents, they beat themselves up.
All the time. I'm not a mom yet, but man, the mom shaming I hear from other parents, and I feel like I have heart-to-hearts with the parents, and I'm like, oh my gosh, your job's tough. Like, I know, It's like, it breaks my heart that I'm like, you guys are going through your own stuff. So, I got to give them a little break sometimes, but still instill that it's important.
Sure. And I love your sleeping bag analogy.
I know.
That is adorable.
I don't know what I was thinking one day, but I use it all the time. And then I do the visual too. And then parents are like, oh, of course. Especially because I see it all the time. We always get occlusal caries on 6s and 12s, before we have the opportunity for sealants to come in. Yeah. Ideally, our doctor wants those first molars completely up, so then we don't have to, get rid of that operculum. But it's a big one, especially things that are getting stuck back there. You don't know that. Or the kids, the parents are like, my kid has more teeth. Where did that happen? So I say, hey, Timmy's getting 6-year-old molars in, but we got some skin covering it, and things want to get stuck underneath. So we got to make sure we're keeping that area nice and clean before we can get those sealants on. So there's a lot of things to incorporate, prevention, but also just a heads up.
Yeah, and I think some parents don't realize that those teeth are coming in and they're not losing a tooth.
And they're adult teeth.
They realize when they lose a tooth that a new tooth is coming in, but those first molars. So I did want to ask you, I know you do a lot of special needs people, and can you tell us a little bit about like how you handle that? Because I just think this is fascinating.
Yeah, also one of my favorite populations, truly, and it's the most rewarding part of my career. It's not an easy one, but I've got children that have various types of disabilities, whether they're wheelchair bound, whether they are on the autism spectrum, whether they have Down syndrome, and they all present with a different need. So it's tailoring every single need. I've got some kids that you have sensory things where, okay, let's figure out how we can work around it. We can do a flavorless, prophy paste, or, I think really it takes a long time just to get them. It's a comfort. I have one patient actually that I saw not too long ago, and I've been seeing him for 6 years now. There was a point in time where he would sit on the floor and he's nonverbal, and I couldn't even get him in the chair. Mom's crying. It's a whole thing now, Yeah, and now I can use a Cavitron on him. He comes in every 3 months because he builds up, but oh my gosh. And it's like the mom's crying of tears of joy now, because it's just building that rapport and routine, repetition. And sometimes they'll take 10 steps forward and then 20 steps back, and then you got to have that patience to get them back where they need to. But I really encourage, if a parent can do every 3 months, it's a big deal. Or even just coming in for like a desensitizing visit. Hey, here's what we're going to show you. This is our motor driven polish. We're going to show you, we're going to have you touch it, we're going to look at it, and this is what we use it for. And sometimes even if they can't 100% understand us intellectually, they know sights and sounds and they can feel, and then it's like, you're okay. And I think really instilling and reiterating, you're okay, I'm here for you. We're going to get your teeth nice and clean, and we're here to help you, and I think it's just an approach factor, but every kid presents with something so different, and I think that's the biggest challenge, because there's nothing the same, and all of my children that present with special accommodations all have something different that's very unique to them, which makes it fun, and they're just, it's like one of my favorite populations. It's not an easy feat, let me tell you, but once we get there, and sometimes even if that first visit, all we can do is just holding a toothbrush, and then the next visit, we get the toothbrush in the mouth. Then we count. It's a very slow building process, but once we get there, like I said, I can use a Cavitron, and my, very, nonverbal autistic patient sits and he knows, okay, I'm in good hands. Like, we're going to be okay. And mom's sitting with me. Everything's good. And talking them through. And sometimes even just something as simple as, like, rubbing their face. Like, I'll have, they just want to feel secure. Or I'll put, like, a lead apron on them. And it's like a thunder jacket.
Yeah.
But even just simple movements of, we're counting, take a break. Or I'll just do, like, a nice little cheek rub, And every kid wants something different. And I start to learn, okay, what works for you doesn't work for this one. Or, something that we can move forward with. And yeah, it's just, every child is so unique, but it's just the little things that, like, okay, this works, we can keep moving with it.
Yeah, you've got to have, like, patience of steel.
Yeah, I've gained so much patience. I truly am, like, nothing phases me anymore. Crying, bring it on. Yeah. I don't get offended.
Well, I do want to kind of switch gears. And I know you are a regional hygiene coach as well. So I want to talk about some of that, because that's fascinating also.
Jack of all trades.
So, yeah, right? And that's wonderful. I think this is really, really great. But how do you approach, like, developing and implementing policies and procedures to ensure high patient care within the hygiene department in your organization?
Yeah, that's a great question, because, it's difficult dealing with patients, but sometimes it's almost more difficult dealing with other professionals, and at the end of the day, I always like to come at it with a collaborative approach. I never want, especially with my patients, but also my other fellow hygienists and team and managers that I work with, I never want to make it seem like this is my decision, this is, a company's decision. It's, it's ADA, it's PDA, you know what I mean? There's so many factors that we're taking into account for patient care. At the end of the day, it's the why behind why we're doing, why we love what we're doing. The patient-centered approach is always going to be the number one for me. So I never want to make it seem like I'm telling you something because this is what we're supposed to do. It's why we're doing it. At the end of the day, how our patients can get the utmost perfect care and how we can give it to them. There'll be times where I get pushbacks from hygienists, especially I have hygienists that are very conservative and they're like, oh, I don't feel comfortable doing this, or having that conversation about oral cancer screenings. And especially with my pediatric population, we recommend doing oral cancer screening starting at age 15, which is a very sensitive subject for a lot of people. And it's a tough conversation to have, especially when we start switching gears into other topics. But I always have that. Is
that primarily because of the HPV?
Yeah, you got
virus?
It. Yeah, and there's a huge rise in it, and also with vaping, tobacco. Not to say that oral cancer, is just a tobacco-related disease anymore, but HPV, unfortunately, is on the rise, and it's a big one. And it's a lot of my hygienists have a very hard time having those very sensitive conversations, not only with their with patients' parents, but also with their patients too. And, once again, circling it back to, first of all, you're the provider, you're the expert. Sometimes it's just having that confidence boost of, you know what you know, and you're the expert. This is why your patients come to you. Trust in yourself and, own it, be confident. And if there's things that you maybe are a little bit insecure about, let's help you get there so then you can have those conversations and feel good about it. Because at the end of the day, we want to make sure that our patients are instilling their trust in us and that we can provide them, everything that we can to help, any type of prevention. But yeah, a lot of I've worked with so many different types of hygienists, and especially I'm on the younger side. So my tenured hygienists that are like, I've been in the game for 30 plus years, and you can't, there's nothing else to learn. And I always laugh and I'm like, trust me, I'm a forever student. I learn from you guys. Like,
yeah, me too.
If I know everything, I don't know anything at all. So I like to learn from my hygienists, my managers, and I want to make it a collaborative teamwork approach where if something's not working, let's talk about it. Let's figure out how we can get you there, because a lot of times people just don't speak up and they'll sit and complain and things that aren't working, but let's figure out how we can get, like, I want to help you guys. Like, let's get everybody on board. So I think incorporating our managers, having open, healthy conversations, and then sometimes, honestly, it's just as simple as a conversation that, like, you don't know what you don't know.
Right. I love that you say that. So the other thing I wanted to say is, how many hygienists do you have in your region?
Oh, goodness. So I cover 8 regions. I've got 36 just solely in Illinois. So I work with Illinois, Indiana, Connecticut, New York, and then a little bit of Massachusetts. So I'm kind of spread all across, where I do a lot of new hire onboarding. I make sure that our hygienists are aware of our procedures and policies, and then also our standard of care of, we have KPIs, or key performance indicators, metrics that is kind of our way of measuring our success. And it's also just a way to hold our hygienists accountable of our standard of care. Are we recommending our fluoride? Are we recommending our oral cancer screenings? Are we doing our perio procedures? Are we using the right codes? That's a whole nother conversation, but I think SRPs and perio coding, it's definitely underdiagnosed for sure. And I think that kind of circles back to conversations with hygienists that they're afraid to disappoint their patients, and they're afraid to tell them bad news about something. But at the end of the day, we need to make sure that we're doing the right codes, and we're doing, gingivitis scaling, we're doing our SRPs if they present with bone loss, and we can have those healthy conversations in a way that's like, I'm not telling you this because it's something that we have to do. This is why this is what I'm seeing. This is what doctor agrees with. We co-collaborate, and then we show, the patient our findings, our x-rays. This is where your bone level's at, or this is, where we're seeing, this is where it needs to be. So we need a little bit of a deeper cleaning, and we're going to put you on a maintenance from there. So once again, going back to healthy conversations, building up hygienist confidence to have those conversations, especially if they're kind of set in their ways.
Sure. So how do you have a collaborative and positive culture within an organization where you have a lot of staff, a lot of different dental hygienists?
Yeah, and that's sometimes almost the toughest thing. As you can tell, I kind of like I said, my speech of the day, serious business, but keep it light, keep it optimistic. I encourage hygienists to own the floor and tell me, how can I help you? This is not my show. This is your show. Same thing, like almost with my pediatric approach. You're the star of the show. Let me be adjunctive. I'm just supplemental to you. I have some tricks of the trade that might be able to help, but I also want to learn from you. What's working for you? What's working for others? We've got a total of 6 coaches. So maybe if pediatrics is something that I shine in, I can help another coach. Or if I have another coach that is really strong in perio, I'll bring her in and have those, stronger conversations. So really just a collaborative approach, but letting the hygienist know that it's an open forum with me, and I'm as open as a book, where I'm pretty vulnerable, and I understand being vulnerable it's a tough thing, but that's how we grow. That's how we get out of our comfort space, and it's scary, but it's also like you'd be surprised on how much you can do if you just kind of open up and get out of your comfort zone for a little bit. So that's one thing. I think just really providing a good culture of, hey, I'm here for you. I'm your person. And I just really instill that, I'm just like you. I'm still at the chair, even though I'm a coach and I do all the admin stuff, and I'm on the different side of dentistry. I'm just like you. I deal with patients showing up late. I deal with all the craziness. So I think it makes me very relatable too. And it's good and bad. But at the same time, I'm like, I'm not just talking at you. I get it. I'm with you. I am you. I totally understand. Which I think helps.
Yeah, I think it's great. I think it's great that you are still clinically,
I love it too much.
A couple of days.
Yeah.
Because I think that does make it so much more relatable when you're talking to other hygienists, because then it's not like you don't know what you're talking about.
I get it.
I'm sitting here. So I think that's great. And you seem so easy to talk to, Stephanie. I'm sure you are so wonderful at this. Now, is there any any special way that you might handle conflict or challenges within the team?
Yeah, there's always going to be a challenge, but like I said, I think coming at it with different perspectives, because maybe I could be closed-minded, and I think almost acknowledging that, and I'll go into in a situation where I'm like, I'm really closed-minded, and I'm maybe not looking at the way that someone else is viewing things. So I think depending on where the conflict is coming from, maybe it's me, or maybe it's the other person, and we're just not seeing eye to eye. So once again, having conversation until we get to a resolution of, are we on the same page? Are we understanding the same thing? And if not, let's help us understand. Because I can tell you there's been so many times where I'm not on the same page, and maybe it's because of me, where I'm like, I just need to understand more, help me understand. Or, just a simple conversation of, I understand where you're coming from, but hey, maybe let's try this and just hear me out, kind of thing.
Sure.
So I think that collaborative approach and just listening, easier said than done. Sometimes I get into my own thoughts and, we take the floor, but I think something so simple as just active listening and letting people just want to be heard. We all want to be heard.
For sure.
Yeah, and everybody's opinions do count. And if someone's passionate about something, you gotta let them be heard, and let's figure out something. So there will always be conflict, but I think there's definitely ways to build on it. Rome was never built in one night, so things take time. And I think we live in a world of just instant, gratification, of instant result, everything needs to be fixed overnight, and it's like small changes build up to a big picture, and I think patience is key. We all need to, understand that, but I think at the end of the day, it's just knowing that things take time, and it'll happen.
Yeah, for sure. And I think too, we have to realize everybody's going through something, and if you're going through something, you may need to share that, so that people understand where you're coming from.
There's an empathetic side to things, and we're human, and things are real, and things happen. So I think also, we get into this robotics phase where we have to break down walls sometimes and just realize that we're people and we're human and things happen. And I think when you come at things with an empathetic understanding of, I understand you as a person and I know what you're capable of, and let's work through this. But I think it's just having that understanding, and people just want to be, they feel safe, and they feel they've been, heard, and you understand me, and not just, okay,
Yeah, for sure. Well, I really appreciate your time today, Stephanie. This has been so fun, and I know that you're just so amazing. I can't wait for us to share this with everyone. So thanks so much. If anyone wants to contact you, what would be the best way for them to reach you?
Yeah, I can either spell out my email. It would be my work address. It's Reynolds s@nadentalgroup.com.
Great. Thanks so much, Stephanie. You take care.
You got it. Thank you so much, Christine. I truly appreciate you.
Thank you for listening to the DSO Hygienist podcast. Please follow or subscribe to be notified of upcoming episodes.